speakers. We have first Professor Arpita Gupta, who will be talking about restraint and resistance in psychiatric halfway homes, ethnographic reflections from India. She will be talking about a reflective account of how people with severe mental health illness in India survive restraining halfway home through quiet and yet active resistance based on ethnographic fieldwork that she's done.
Hello,
We
everyone. I am Dr. Arpita Gupta. I am talking about restraint and resistance in psychiatric halfway homes. It's an ethnographic reflective account. Before I start, I do want to talk about how this is a work that is currently ongoing. I'm working with a colleague of mine from Ms. Neha Jain. She is right now researching at Indian Institute of Technology, Kanpur, and this is where I did my doctoral education from. A little about my background. I'm actually a clinical psychologist. I am trained at a psychiatric institute that's more than 100 years old in India. And a lot of my research work in this area, in the area of severe mental illness, comes from my own experiences of getting trained at that place, as well as doing my PhD work in this area at a number of psychiatric places. And one of those places is a halfway home. I'll quickly talk about what do I mean by a halfway home. So for my doctoral work, I had reached out to a lot of psychiatric institutions, hospitals, clinics, public health centers, daycares, where people with severe mental illness can come and spend the entire day. And something called a halfway home, which is an idea of providing a transition space for people with severe mental illnesses, those who are trying to get back into the community. A halfway home is a place that helps people with the diagnosis of recovering people with the diagnosis of severe mental illness, work on their social skills, work on their, occupational skills, and be able to come back to the community. So this is one of the halfway homes where I'd sort of interacted with people who were staying there. And in my work, what I noticed was that these trans institutionals, like halfway homes, while trying to sort of help people in getting back on their foot and getting back into the community, contrary to the popular idea that, they can be restrictive to patients. They're, from harm, from self-harm, or from harming others. We recognize that these spaces are restraining for a lot of, not just for the patients, but they're restraining for the staff, for the family members of the patients, and even for researchers like us who go to these spaces to understand the experiences of people who have mental illnesses. I'll talk more about this, but I'll quickly give a background of why we reached this position. So this is an article that I'm sharing, published quite a while ago, where it's an account of the fieldwork that one does, qualitative fieldwork that one does in order to get close to the context and experiences of illness. And in this particular article, I talked about how there's so much structural violence that exists that within mental health care institutions that are supposed to help people recover from severe mental illnesses, but end up becoming a hindrance in their recovery processes. More recently, and there's a QR code if people might want to read this article more. More recently, in an article that was published last year, We talked about, or I'm one of the authors, and from my experience of being at this halfway home and interacting with people there, I talked about what is required for a space, for a mental health space to be a more humanizing space. And it is based on these experiences that, collectively, me and my colleague, we have been reflecting on what are the kind of restraints that exist in these institutions. We've found that the physical location of these institutions, and most of them are on the margins of societies and cities, and makes it really difficult for any kind of real community integration to happen for these people because of how far off they are from community and from these people's own houses and family members. The way these spaces are built, the kind of regimes they follow, the kind of spaces that are accessible and not accessible at specific times to the residents, the kind of environment that gets created within these spaces, the surveillance that exists, either through cameras or through staff, and not just of the patient, but the surveillance of the staff and the mental health professionals working in these spaces, and how that creates an environment of restraint for everyone that comes in the way of a genuine connection to establish in these spaces. um, Identifying the aspects of care that seem more coercive rather than facilitative for people, as well as the kind of infantilization that's very noticeable of the patients by staff, by mental health professionals, by authorities in these spaces. Building on, we are also working on if this is what the restraint is, what might resistance towards these restraints look like in such spaces? How do patients actively resist such restraints? How do staff navigate such restraints within mental health care spaces? And if this is something that interests any of the people present here, I'd be happy to get in touch with them, talk more about it, explore common areas of interest. That's it on my end.